Back at 8:13, coffee, tea, video games. They appear to be the newest weapons in the fight against Alzheimer's disease and dementia. New studies are showing some promise on how those things can help lower the risk for the brain disease. There's also breaking news this morning when it comes to the flu vaccine and a local pharmaceutical company. We're pleased to be joined this morning by Dr. Anahita Dua, a surgeon at Mass General Hospital and founder and chair of the Healthcare for Action. Dr. Dua, good to see you this morning. Let's start with that breaking news this morning. The FDA blocking Moderna's application for the flu vaccine. They were looking for approval of an mRNA flu shot. Does this come as a surprise to you at all? And what might the beef be with the FDA with this vaccine?
You know, it does come as a surprise, but also not a surprise because, as we've heard recently, there's been a lot of talk about how mRNA vaccines are concerning to the administration, even though there's a lot of data to support them. There's multiple studies with thousands of children to know that mRNA vaccines are indeed safe and good. And prior to anything to do with COVID or the flu, we were using mRNA technology for cancers. Unfortunately, what's happened in this particular situation is that there's been no question about the efficacy of the medication and the vaccine that Moderna is putting forward. What's really been the issue is the FDA has a problem with the process. They don't like what the Moderna group compared their vaccine to, even though they had already told them in previous meetings that the way that they had designed their study was appropriate.
So it's not so much the potential effectiveness of the vaccine, but the process that they went through here to apply and present it to the FDA.
Exactly. You know, RFK has said historically that he wants vaccines to be compared to placebo. Placebo is basically just using something that's completely fake and then comparing it to whatever you're studying. The problem with doing that with vaccines, though, is that it's basically unethical. If you have a vaccine out there that works and you have a better vaccine that you come out with, as in the case of Moderna, then the appropriate way to study is to compare the new thing to the old standard of care, not just to say that we're going to have a placebo comparison, because that would mean that a subset of patients would be getting no treatment at all when there is already an FDA-approved treatment. So while it's a little complex, this is a bit disconcerting because the real issue seems to be about the fact that they use mRNA technology.
All right, let's get to that promising news we talked about. Two studies related to the prevention of Alzheimer's disease and dementia. An in-depth study in the journal Alzheimer's and Dementia found that playing a brain training video game can protect the brain from dementia for decades. What's your takeaway from this study?
Well, that's really interesting, and this is not too surprising. Basically, this is like saying that if you work out in the gym every single week, a couple times a week, you're going to have a better, healthier life, which we know physically. This is just saying the same thing mentally. They've created a game that actually works on kind of cognitive speed, so it's not just memory. In dementia and Alzheimer's, we always think of memory only, but it's actually cognition and the ability to think through things. This game focuses on that, and if you train your brain over time, this study did find over a long duration of time that there was a 25% decrease in patients who got dementia ultimately as compared to those who did not use the game.
So what would the practical application be of this? Just play this video game and play it as often as you can?
Yes, basically. I mean, we would have to do a randomized control trial ultimately, but that would be exactly what it would be. In the same way that your doctor says you should work out 3 times a week, you know, take that walk, go to the gym, this would be the same thing, that you should be doing some brain training exercises to prevent dementia, especially if you might be at higher risk for it.
All right, Dr. Dua, there's also that other study which shows for those who drink 1 or 2 cups of caffeinated coffee or tea a day also had a lower risk of dementia. The study out of the Harvard T.H. Chan School of Public Health. Is this basically all related to caffeine?
It seems like that is the case, because when you look at studies that compared, basically, it seems to be that 300 milligrams of caffeine that really seems to help people. But it's not just a go drink coffee, go drink tea, spike yourself with caffeine, because, of course, if you have too much of it out of moderation, you can then end up with sleep disturbances, heart palpitations, other negative things. So as the writer of the study said as well, if you're not a coffee drinker, don't necessarily start. But indeed, caffeine does seem to have an effect. And there's real physiological reasons for that have to do with signaling in the brain and adenosine receptors. So it does make physiological sense.
So would this apply to other drinks that have caffeine, sodas, energy drinks, for example?
hopefully, because I drink a lot of caffeine and Diet Coke. But indeed, that probably is true, that it does apply to caffeine regardless of how. But it's important to do studies on this to say anything, because it's all about unintended consequences. While it may be helping you in this realm, it may be hurting you in another. So it's important to finally do a randomized controlled trial, really hone down on how much caffeine is appropriate and in what form, because that's really the key to actually making dementia go away.
Right. I'm more of a Diet Pepsi guy. But same thing, the caffeine in there. I don't want to start a cola war with you. I'm just saying the sodas are where it's kind of at as far as the caffeine is concerned for a lot of folks here. We appreciate your insight this morning, Dr. Anahita Dua from Mass General Hospital, or Dua, pardon me, from Mass General. Thanks so much for your time this morning. Appreciate it.
Thank you for having me.